Hello, this is Dr. Eric Chapman from Chapman Wellcare, and in today's video we're going to talk about how these little holes in your skull can be the key to fixing lacerations on a patient's face the best way possible. So I'm Dr. Eric Chapman, Medical Director and founder of Chapman Wellcare in Naples, Florida. We're a hybrid medical practice that has urgent care, primary care, and employee health. I have this model of a human skull, and I want to talk about these three little holes that we have in our facial bones. And you can see that there's one here, here, and here, and we have them on both sides. These are called foramen. Foramen is just a medical term that means hole or exit point. And from these foramen, our nerves come out of our skull and provide sensation to the skin on our face. So we have our mental foramen, our infraorbital foramen, or infra meaning below the orbit, and we have our supraorbital foramen. This is important when you're dealing with someone who's maybe cut their face or cut their lip, because when you're trying to stitch a cut that's on the face, you really want to make that as perfect as possible. And you can't do that if you're injecting anesthetic right into the cut, because the volume of anesthetic that you put into that cut causes swelling and a distortion of the anatomy. So you have to have a way to numb the area that you're working on so the patient doesn't have pain, and you can use the needle to stitch back the affected area. But you want to do it in a way where you have symmetry, because when you're dealing with cuts on the face or an injury to the face, what's going to be visible to the public in terms of what may look like a defect or a scar is asymmetry. And the last thing that you want to do is pump up a cut filled with a good amount of anesthetic, so where now you can't bring those edges back perfectly, or the anatomy is distorted. And this is actually something that dentists will do for a completely other reason, which is they can open up the lip and go above the gum line or below towards the chin, and you're numbing up that region. So not only does it numb up the face or the lips, but it also numbs up the teeth. So this is a great way to numb the affected area and have the ability to work on that portion of the face without distorting the anatomy. And that's really the best, most effective way to fix a cut on the face without compromising the aesthetic look. So what we're talking about here would be called a mental block, an infraorbital block, or a supraorbital block. But most of the time we're dealing with these 2 points right here. And like I had mentioned just a few moments earlier, you can take this needle, you open up the lip, and you inject into the gum line going parallel. And that way you don't have to inject the actual cut. Hopefully this helps. Hopefully this was educational. If you have any questions, you can reach out to us at 239-359-6500. Thank you very much. Have a good day.